This morning, according to the Leukemia and Lymphoma Society, approximately every 9 minutes, someone in the U.S. dies from a blood cancer. That's leukemia, lymphoma, and myeloma. Those are the cause of death for about 57,000 people in the U.S. this year. Our reporter, Nye Remy, has more on the findings in North Dakota. Good morning, Nye.
Good morning, Alicia. The estimated new cases in cancer overall here in our state is about 4,000 with 1,300 deaths in this year alone. When it comes down to blood cancer, though, there are 160 cases of leukemia and 70 deaths this year. LLS.org says 1 in 3 people can't actually identify the symptoms, but blood cancer gives itself away through swollen gums, recurrent infections, excess bleeding, shortness of breath, low back pain in the elderly, generalized weakness, and prolonged fevers. It is highly encouraged to see a doctor if you're feeling any of these symptoms. In honor of Blood Cancer Awareness Month, I took a visit to Sanford Medical Center and was able to shadow an RN who specializes in cancer patients, which is where I met Larry Brenno, a blood cancer patient at their facility, to get an inside look of his day-to-day life. First off, what is blood cancer?
Blood cancer is actually pretty prevalent. It is one of those things that can just sneak up on you.
Most blood cancers start in the bone marrow, where blood cells are produced. Blood cancers can spiral when abnormal blood cells grow out of control. Now that we have a good grasp of what this disease is, let's go on to the 4th floor, where all the cancer treatment takes place in the Sanford Cancer Center in Bismarck, and meet one of their cancer patients who is considered to be one of their biggest fighters here, Larry.
But I'm 82 and I feel in pretty good health.
Larry has stomach cancer, lung cancer, and blood cancer, and although some may hear this and think the worst, Larry says he lives a pretty normal life.
The next day after chemo, when I was sick, pretty sick, but I was in the shop working with the people. There's no reason you can't quit. The main thing in life is whether you got any kind of cancer, anything, just work, keep going.
Larry was actually diagnosed with blood cancer at first, but with the treatment we have today and his doctors catching it at a good stage, he says it's what saved him. And although Larry has to take a trip to Sanford Medical Center every 2 months to do chemotherapy, he says having the condition made his heart bigger, and he will continue to work with others and show them, no matter what, you cannot give up.
But we can't go and sit on the couch and feel sorry for ourselves, and then in 2 months you're all crippled up and you want to die, and then you're done. So just for you people out there that got this problem, fight it.
Samantha Wagner, a nurse at Sanford Medical Center for over 8 years, says working with blood cancer patients is extremely rewarding when you see how far they've come.
We get to be a part of their journey. We get to be with them from beginning to end, and we get to see their fight. We get to meet their family. We get to see all of their struggles, all of their triumphs. It's wonderful.
Wagner says she admires Larry and is so proud to see how far he's come throughout his journey.
You know, Larry is a fighter. He has been here for a long time, and he's just one of those people who doesn't stop, and that's the fighting spirit that we come to love in a lot of our patients.
I received a quote from Larry's doctor, Dr. Gray, who says, Larry has had lymphoma for over 8 to 10 years, and he recently had a recurrence. There are many new treatments for blood cancers, so patients like Larry are living longer with good quality life.
Just amazing. Sounds like a man who will never let anything bring him down. I mean, just that battle alone.
Right, for sure. Very inspiring. And I got on my red today to support Larry and everyone fighting the disease. And our love and support goes out to everyone.
Absolutely. Thank you so much for that story.
For sure.